So, can you give us a description of your job, please?
Sure, I'm happy to. I'm a family physician and I work with the United States Public Health Service. Specifically, I work with the Health Resources and Services Administration, which is part of the federal Department of Health and Human Services, and at that agency I work as the Chief Public Health Officer.
Cool. So, can you give us some public health projects you've worked on?
Sure, I've worked on a number of different public health projects over the years, including some on nutrition. More recently, I've been working to help the fields of public health and primary care work better together to help improve the health not only of individual people but populations.
Cool. Can you define primary care for us?
Sure. Primary care is when an individual person is seeking health care, and it's the actions that we take as one family physician to keep somebody healthy, and they come in for a checkup or they have a problem, and I help them with that. And that's in contrast to public health, which is maybe taking care of all the students at a school, for example, or all the members of a certain community.
I see. Okay, so we're going to jump to the dieting theme for our documentary. So, first question is, how is dieting developed, you think, from a weight loss program to achieving different goals such as maintaining weight or even putting on muscle?
Well, I think over time people have changed how they think about dieting, and in the past dieting has been focused on just losing weight, and so people might cut back their food a little bit. But as I said, over time people are recognizing the importance of not only cutting back the amount of food you eat, but what types of food you eat and how much nutrition it has, and also, very importantly, adding physical activity into their daily routine. Physical activity helps improve your heart health, and it also helps build muscle.
Do you think it's easier to diet if you're a male or a female, and if so, why?
Well, I think it's probably a challenge for anybody to diet, because dieting involves changing something from what your normal day-to-day is. I think there are probably more social pressures on women to diet than on men, and probably that comes from images of women we see in magazines, on TV, etc., to be slender and thin.
Cool. So, do you recommend taking supplements for anything, or you think differently?
Do you mean taking supplements for weight loss?
Well, just supplements in general. That could be vitamin supplements or weight loss supplements or things like that.
Well, one thing I'd like to say about supplements is that many supplements that are sold over the counter are not things that are necessarily studied very well, and they may not have been reviewed by the Food and Drug Administration, which looks at medicines we take and foods that we eat to make sure things are safe and not harmful, or that the benefit of taking the medicine or the supplement is greater than whatever risk. So if these things aren't studied and there's not a lot of information about them, then I am very cautious in recommending them to people. But there are some things that people have used for years and years and decades, and it seems that they can be helpful, and in those cases I may not recommend it, but I may not advise against it.
I see.
Can we cut here? I think